There's two things I think that will help a lot, and that is, or maybe three things that I can think of. The applying the estrel cream creates a barrier in the vagina. So the bacteria that colonize comes from the anus. There's lots of bacteria in the anus. That's normal. E. coli, Klebsiella, Proteus, stuff like that. They are needed in our gut. So they are active in the anus. Then the little area between the opening of the vagina, the introitus, is called the perineal body. So it's good to apply some of the estrel cream in there as well. Not in the anus, but in that little space in between the introitus and the anus. And then around and a little bit around the urethra as well, especially in the beginning of your treatment, not just everything going inside. The reason is that over time, if we can establish that protective barrier again, then we will the barrier will prevent that the bacteria from the anus can colonize and go up to the bladder. So that is really helpful. In the beginning, I think when you start being sexually active, it's good to take a cranberry extract little capsule. Now there's so many, or tablet, there's so many on the market that it's not worthwhile for me to give you a brand name, but make sure that when you go to the health shop, every single day, take a tablet that contains 500 to 750 milligrams of cranberry. Now, you will have to drink a lot of cranberry juice the whole day long to get to that concentration. And the beautiful thing about cranberry is that it's not an antibiotic, but we know that it's bacteriostatic. What it means is it stays on the inside of your bladder, in the urine, and it actually bats. It protects you against organism that will start to grow into or become a UTI infection. So it prevents infection from happening. Just what all women should do, and that is to empty their bladders directly after being intimate, and try not to use toilet paper, but use unfragrant a wet wipe, and clean from front to back and throw it away. And if you want to do another one, from front to back, not movement in the direction back to front, but just always from front to back and throw it away. I do also think that it's good after there was penetration to soothe the skin of the vulva and that perineal area with a little bit a little bit of Bepanthen or pseudocreme or fish and paste. Any bum cream that you can use for babies contains zinc, and that's also something, an antioxidant that helps to protect the skin. Sometimes you can use a numbing cream like Imla or a Remicade, Anathane, anything like that on the outer lips as well, if there's some chafing that you want to soothe. But I do think, emptying the bladder and cleaning in the right direction, using, especially, I would say, the first 3 months of when you start to pick up your sex life again, use the cranberry every single day, and then continue with the estrel cream to build up that layer. And over time, the longer you are on the estrel cream, you don't have to put it in all that areas all the time. You can actually just put it on the inside.